Hi, everybody. Welcome back. The big takeaways from this chapter on childhood disorders are these. Now, first, here's a memory tip to remember the difference between externalizing disorders versus internalizing disorders. First of all, externalizing disorders have symptoms that are on the outside, they're external. Think things like attention deficit hyperactivity disorder with its hyperactive behavior, conduct disorders with behaviors like violence or assault. The symptoms are on the outside. Those are externalizing disorders. Internalizing disorders have symptoms that are on the inside. They're internal. So think of things like depressive symptoms or anxiety or low self-esteem. Those are symptoms that are on the inside. So we call those collectively internalizing disorders. The second big takeaway, childhood disorders are distinct in this course for several reasons, different from all the other diagnoses we've talked about so far. First of all, when we diagnose children, we must first subtract the idiosyncrasies of normal childhood. You got to admit, kids are a little strange to us adults sometimes because they often act in unfiltered ways, in non-self-conscious ways, like children, like adults sometimes do. Unlike adults, kids tend not to worry about being viewed awkwardly if they do things like they sing to themselves in public, or they run a few steps and then walk a few steps and then run a few steps. If a child tells a complete stranger that they got dressed all by themselves that morning and they're really excited about it. The point is this: when we diagnose children, we must first subtract the idiosyncrasies and sometimes just the plain weirdness that children can exhibit sometimes. Then we look for abnormality in what's left. It's important to keep this in mind, how different normal children's behavior can be from adults, especially if you yourself do not spend much time around children on a regular basis. The second thing that makes the second way in which childhood disorders are distinct, the diagnosed client, our client, which is the child, is often not the source of diagnostic information or symptoms, but rather it is often the parents or the teachers or the caregivers who provide us, the practitioner, the symptoms for our diagnosis. The client, who may be aged 4 to age 10, is often simply not able to describe thoughts or emotions like low mood or guilt, the things that underlie their behavior, except in very basic ways, like to say, I'm sad, or my stomach hurts, or something like that. All the information does not come from the client, it comes from somebody else. That's distinct. The third way that childhood disorders are distinct is we need to be careful about applying adult diagnoses like major depressive disorder or generalized anxiety disorder or schizophrenia. Adult diagnoses should not be applied to small children. Even though you may have heard this on a radio show or saw it on television or saw it on a talk show, there's a couple of good reasons why we do not apply adult disorders to small children. The first good reason is that one cannot verify the symptoms with small children because they often do not comprehend our questions about such abstract adult concepts like stress or mood or things like that. The second good reason why we don't apply adult disorders to children is we also do not benefit from applying them. We apply them to kids, but we would not ever think of prescribing the same treatments for a child that we do for adults. Drug therapy, for example, or even talk therapy, psychotherapy. We wouldn't do that with a child. So what do we really gain by applying an adult diagnosis to a child? A couple of good reasons why we don't want to do that. The third big takeaway here is regarding autism, specifically autistic spectrum disorder, the etiology. To be clear, we do not know what causes autism. There are many individual studies that have proposed specific causes, like food additives or vaccines or something like that, but there is no consistent pattern that has been observed. And to be clear, we do not know what causes autism at this point. The fourth big takeaway is about understanding the causes of children's behavior. And there's a PDF article that I ask you to look at called Poor Parenting. There's no pill for that. Poor Parenting is the name of the article. It's inside the module. This article presents a really interesting point of view that is popular but very quiet because it can make some parents uncomfortable. The idea that their poor parenting ability may be contributing to their child's behavior problems. The truth is that behavioral problems in children have many factors, many causes that can contribute to them, and parents really should be open to learn self-improvement, at least to see if it has any positive impact on a child's behavior or functioning. Lastly, the last big takeaway here is about treatment for childhood disorders. A substantial part of treatment for childhood disorders involves training the parents to do the same types of interventions on a daily basis that a psychologist only provides once a week. A couple of benefits to this, teaching essentially training the parents to be therapists. First benefit is that you see an increased frequency of the daily therapy from parents, and that's better for the child. Parents are living with them, they're present every day to offer assistance and support, where the psychologist is only available to the child like once a week. The second benefit here is teaching the parents how to be therapists. It helps the parents feel like better parents, and that can go a long way to helping a child heal. Remember that by the time that a family comes to the clinic to ask for help, parents may have a wounded sense of their parenting abilities after such a struggle with their child, trying to understand what the problem was. So using these new skills, teaching these new skills, helps parents feel like better parents. That's important. So in summary, a couple of things in summary here. Childhood disorders are distinct for a lot of reasons. Remember, in diagnosing, you first have to subtract the idiosyncrasies of normal childhood. They just don't behave like adults to begin with. Remember also with children, what's unique is that the source of diagnostic information is not the patient. It's often other people, parents, teachers. Lastly, adult diagnoses should generally not be applied to small children. We cannot verify the symptoms, and even if we did apply the diagnosis, we wouldn't use the same therapies that we would on adults, on children as we would on adults. The last thing is, remember the etiology of autistic disorder. Let's be clear, we don't know what causes autism, despite claims you might have heard otherwise, caused by vaccines or other things like that. We don't know at this point in the research what causes autism. Those are the big takeaways from this chapter on childhood disorders. Thank you, everybody.